This webinar is being recorded.
Thank you, Mr. President. Chris Pratt with the County Attorney's Office. All of the items on this evening's agenda have been reviewed by the County Attorney's Office and meet legal approval.
Excellent. Are there any member disclosure for any items on this agenda? I have none. Dr. Fielding?
None.
Perfect. Thank you. So we're going to move into the consent agenda. Beforehand, we do have quite a bit of stuff. Well, at least one big item on the agenda. I've instructed staff to act or proceed as if we've all read the material beforehand. And so they're gonna move through the agenda. Certainly, if there are questions, we please ask the questions that you have. But they don't. I've told them because what they provided in writing, they should not be going over again verbally, because I just don't think that's a good use of time. So, staff, if you will please take that instruction, I would appreciate it. Second, before I forget, I want to mention this. We do have a new facility housing our county health department, which puts everybody in one place, and I'm getting good reviews on it. Director Hill, I think it would be a good idea to have our meetings there, though I know the commissioners are here, so would you please check with the commissioners and see, and just determine whether or not having the meeting down there would work with their schedule. They have a very busy schedule, so we want to accommodate their schedule, but if we could have it down where, you know, all of your folks are when you are, I think that would be I think that would be a good option. But let's just check and make sure that that's not going to conflict with the county commissioner's schedule. We have the consent agenda. We have two items on the consent agenda. First, review and approve of minutes from our March meeting. And second, review and approve a financial report through August 31st, 2025. Has everybody reviewed the minutes? Are there any revisions to the minutes that anybody would like to make? No? Okay. With that, then, what I would do, and Mr. Pratt, I'm going to do this unless you tell me I can't. We're just going to do it en banc. We're going to do or en blanc, or a block vote on both items. So I would accept a motion to approve the minutes of our March 13th, 2025 meeting and approve the financial report through August 31st, 2025.
Okay. I move that we review and approve the minutes of March 13th, 2025, and we have also approved the financial report through 8/31/2025.
Excellent. And we have a motion and a second. All in favor, say aye. Aye. Opposed? Excellent. So let's move on to the regular agenda. Director Hill, you want to give an update, and then we will move on to our items to vote upon.
Yes, sir. And following instructions, I'm not going to read from my report very much. The biggest thing of consequence since we last met was, as the president stated, we've moved into a nice new facility, which I hope you'll all come and visit sometime and take a look at. And it does have possibly the best conference room facility the county owns, so it would be a good place for maybe us to move our Board of Health meetings if the commissioners are okay with that.
Would it work for public comment too? I didn't think about that, but do we have, is there appropriate space for public comment?
Yeah, I mean, it fits 100 people.
Oh, okay.
Plus, and it has full AV setup, microphones, everything just like this room does.
Well, if there are 100 people that want to comment on things that you're doing, we're going to have a discussion.
I believe you're correct, yes, sir. That'll be an interesting discussion, but yeah, pretty much that's the big news. That really tied up a whole lot of our time in the month of July, was getting moved from two older facilities into this new facility and get everything organized. But I think everybody's happy with it. They look like they're smiling, and Eden just smiled, so it's all good back there. So it's been a great move for us, and we really appreciate the commissioners taking on the burden of the lease for this facility for us. It's been great. And otherwise, I mean, everything I've done is reported in here. Diseases are pretty much under control right now. Flu and RSV were a little bit high in the winter, but died down in the summer. COVID-19 there's been some action around the country, but pretty quiet around here. Pertussis again last spring was really booming, and it declined as soon as it got warm again. Measles is still bubbling here and there around the country. Nothing big, no cases have actually made it to our county. We've had plenty of suspects to investigate, but no actual cases. And other than that, I'm going to follow directions and stop talking about that, but I'll answer any questions.
Just real quick, we were talking a little bit about this before the meeting. The upcoming flu season, what are the flu/COVID season? What are the expectations for that?
Well, I'm expecting a normal flu season, whatever that means, because usually it's telegraphed by what's going on in the southern hemisphere, and I've not heard any big news coming out of the southern hemisphere, which leads me to believe it's going to be kind of a status quo flu season. But with flu seasons, you'll know how it's going to be when it's over with.
Right. Okay. Thank you. Okay, so let's move to the action items then, unless there are any questions on any of the other reports. Are there any other? Okay. Let's move to the action items then, and a request to accept funding received since the March meeting. This is the big item on our agenda. There are a whole host of items. I understand most of them are ongoing, are issues that are, or programs that we've been running. I think there are a few new ones that that will be described to us. But why don't we start with that presentation, because there's $3 million here, so I think we all want to understand what's in it.
Yes, sir, and we didn't prepare a presentation for this. We've just we're ready to accept questions and do some explaining. And all the big ticket items in here are recurring items, as you've said. They're all things that the board has authorized us to do and to accept funding for in the past. There's a few smaller grants that we've accepted over the summer. Like we got a car seat grant from the E470. We got a grant to provide people who want them with lock boxes for their firearms for firearm safety. I forget who we got that grant from. Laura can explain if you're interested. But we're happy to speak about any of those smaller grants or even the big ones, but none of the big ones should be news. There's WIC preparedness, all things that we've been doing since day one.
Okay. So I looked at some of the smaller ones. The gun safety one is a program where people can come and have to affirmatively request this, that they want this, that if they have guns, they want to lock them up, and you guys will provide. It's a gun lock, correct? You're not providing safes. It's just a gun lock.
There's safes as well.
Oh,
yeah.
really? Okay.
And I mean, Laura can give you the details if you like. She's the manager over this.
I'm just wanting to make sure the program's voluntary. People can come in and grab it. We're not collecting information from them. We're just giving them what they asked for and moving on. Is that right?
Yes, sir. And they sold like hotcakes. There are a lot of people were wanting a way to secure their, especially handguns, so kids aren't. A lot of older people, I believe, and didn't want their grandkids to come visit and get a hold of the handgun and have a problem. So it's nothing about us telling us you have to lock up your guns, but here's some money we got to help you out if you want to lock up your gun to make it safe.
Are there any folks have questions, comments? Well, the other one I just want the WIC grant. There were provisions for handing out car seats to folks that I think are enrolled in WIC, folks that may not be able to otherwise afford them. Is that, or would have difficulty? Is that correct?
Yeah, the car seat one is, we just have the one from 470. Yes, those 470 authority gave us money to provide car seats. And what we do when we get, mostly they're going to be WIC people that turn up at our office, but when we get someone who is in need and needs a car seat, we go and buy them from UC Health, I believe. Yeah, UC Children's Hospital and provide them with a car seat. So it's not, we're not stocking car seats, we're just buying them as needed for people who want and need them.
Okay. Yeah, I think some of the other ones I look, I mean, were consistent with past years, so I will, again, ask if there are any questions from folks.
I mean, it's all transparent. Anything you want to know, we will inform you, so ask away.
I'm aware of that. Well, is there any public comment in the room on this issue? Is there any public comment online?
No, Mr. President.
Okay. So we should vote on these each as we go through them, correct?
Yes, sir.
Okay. With no other questions then, or comments from board members, I would accept a motion to, my apologies. I would accept a motion to approve DCHD funding allocation received after the March 2025 board meeting.
So move.
Thank you. Second? We have a
Whoever you want.
we have a motion and a second. I appreciate. All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Let's move to the body art regulation amendments. And we are approving amendments to the body art regulations. I thought we just did that in,
So, yes, sir,
March.
we presented on this in June, but we didn't have a quorum, so we
Oh.
couldn't take a formal vote on it.
that's right. Okay, thank you.
All right. Hello, I'm Skylar Seacard. I'm the Assistant Director of Environmental Health here at Douglas County Health Department. On the screen, you will see our current language and our proposed language. We identified a gap between what we have here locally and what is out there in the state level. So we're looking to realign our position to match that of the state.
What are the revisions? I apologize. Proposed language. What do the revisions do?
Yes, so it brings us into compliance. So we have our definition here that says ear piercing shall be exempt from these regulations. In the state verbiage, it does allow for us to license people that would like to pierce ears, but it does give an exemption for anyone using the pre-sterilized ear piercing systems.
Okay.
So the ear piercing guns, if you
Yeah.
will.
Yeah, okay, so so what we're doing is we're exempting, we'll be including language exempting those folks or from regulation.
Correct.
Excellent.
I
Dr.
would
Fielding.
assume that's traditionally the people that sell jewelry and then will pierce your ear so you can wear it.
Yes.
Yeah.
Yes.
Okay. Any questions on this? I recall this from June. Any questions on this? Discussion? Okay. Is there any public comment on this? Is there any public comment online?
No, Mr. President.
Okay. Well, again, I would accept a motion to approve revisions to the DCHD body art regulation.
I'd like to move to approve to replace the Regulation 2202 with Regulation 25-01 body art establishments as presented.
Thank you. Is there a second?
Second.
And we have a second. All in favor, say aye.
Aye.
Aye. Opposed? Great, thank you. Let's move on to gray water regulation.
And while Skylar switches presentations, this is not something that your board regulates but the state has asked that boards of health provide input, if they so desire, to the county on these gray water systems. So that's what the presentation is asking for, input if you care to provide it.
So, I mean, are you asking us right now, do we have any sort of gray water thoughts that we should want, that we should share with you?
So the idea is that after.
Can you start out with, talk about gray water first? Tell everybody, folks probably know it, but maybe folks online or maybe folks don't. So let's talk, tell us what gray water is.
You like to stretch various aspects of my public health knowledge. I like that. So gray water is like, a good example is your laundry water that comes out of your washing machine. It's not like black water that's coming from your toilet that's totally contaminated. It still has the potential to be contaminated, so it needs to go through some kind of treatment program before it's used in another way. But these gray water systems, and tell me if Skylar's shaking her head behind me, these gray water systems aim to take like the water from your washing machine or maybe from your sink that's not totally contaminated with fecal material, give it some brief treatment, and then reuse it either back into your toilet to flush toilets with, or maybe for irrigation or for other non-potable uses. How'd I do?
You did great. Thank you, Director Hill.
Castle Rock actually has a program for that.
Yeah.
So there are some pretty solid examples out there.
Yeah, I mean, I think there's issues still with the cost and the maintenance of those systems, so I'm skeptical if they're really, the run-of-the-mill user is ready to run with these things. But again, it's up to your board if you want to express an opinion. To the building department, I think, is who we're addressing this to, and it's their decision whether they want to do a regulation in the county for this, but you're just expressing your thought if you have a thought. You don't have to express an opinion if you don't want to.
Well, I'll start off with an opinion. My opinion is what I don't want to create is any requirement for home builders or to have to put something in. I mean, if folks want to do this, I think that's great, and providing them information on it would be wonderful. But you know, I don't, and I, as you said, and we spoke a little bit about this earlier. There is a cost to this, and the technology may not be exactly where we want it to be. In other words, I think we should be in a position of reviewing it and not being a leader, but perhaps being a fast follower, though not fast following on any requirement that would raise the price of homes, was my view. But Kevin, or Ms. Bracken, it sounds like you may have some more experience on this than the rest of us.
Yeah, just my understanding of it is that it does offset water bills, and it does create, you know, lower usage of water. So that's why the program's out there. It's incentivized by the town of Castle Rock because they're using less water, being more efficient, and so I think there's good upside to it. But it's a voluntary option, and it's not mandated or required. So I think it's probably to your comment. You know, I don't think we need to get in the middle of whether folks want to recycle water or not within their home.
And if I could jump in here, there has been changes to the state law regarding gray water. So what was previously an opt-in is now an opt-out situation. Of course. See if I can scroll through this a little bit. Sorry, I'm going really fast here. I was trying to get to some of the summary slides. So as far as our House bill goes, all the way back up. Excuse me. So once again, this right here is an opt-out program at this point in time. If we don't adopt, if we choose to opt out, this means that we would negate the need to set up an entire gray water program here in the county. If we don't take any action as a county, these will be effective as of January 1st, 2026. And we can always later choose to opt in if we so desire.
That's helpful.
I have one question.
Oh, Doctor.
This is residential usage primarily, not larger areas such as golf courses?
Correct.
Okay.
And, oh, yes.
Mr. President, I had some, I guess you'd say, concerns, because as far as the technology goes, as far as really how are the pathogens going to be handled, will that be adequate? How would the training go for people to install this, and what's going to be the upkeep in order to prevent pathogens from leaking into our water systems, our regular water systems? So my feeling would be to opt out, but easily opt in once we find out some of the answers to how this would be going.
And opting out wouldn't impact anything Castle Rock is doing, is that correct?
Correct. Anything that has already been installed would be grandfathered in, so to speak.
Okay. And if there was somebody that wanted to do a gray water system in their house and we had opted out, that doesn't prevent them from doing that, correct?
It's like, it would prevent them from doing that because we wouldn't have the regulatory framework to help the process along.
But they could just do it on their own, couldn't they?
It would be illegal to do so, sir.
Oh, well, I don't want to suggest that then.
If I may, Mr. President, Chris Pratt, the County Attorney's Office, to provide a little more background, it wasn't that many years ago it was forbidden to do this outright. The legislature provided an opt-in program. The county did, in fact, opt in on a kind of a test basis, and Matt Jabowski from the building department's here if I misspeak. They kind of tried a pilot program to see if this would be popular, if it would be something people would want to do. I believe, if I remember correctly, it was not particularly popular. It did require a considerable amount of additional hardware to be installed in the home. They required maintenance. There were some complaints about smell and upkeep, and it was not widely used. So the new system would require us to opt out if we wanted to not have a gray water system. We could opt in and allow it in certain instances or certain types of systems. And again, this is not something the Board of Health will be deciding, but if you'd like to provide some input to the Board of County Commissioners, they would be the ones to implement ultimately to decide whether to opt in or opt out and what that would look like only for unincorporated areas of the county. It would not affect municipalities.
This might, however, come under the Board of Health if there are health concerns about this, so we could get dragged into this.
Thank you. I do, okay, this is my view, and folks weigh in on it because, but I agree with an opt-out. I agree that what I would recommend to the commissioners is that they opt out based upon past experience and because of the fact that if a municipality wants to do it, they retain the right to go ahead and do it. And they were grandfathered in if they have chosen that, and we're not interfering with sort of their decision. I would also recommend that they continue to follow the state of technology, and just frankly follow to see if there's any increased demand. I mean, look, if we see that in, Jeffco, people are beating down the doors for these, then we may want to reconsider. But at this point, I'm a little uncomfortable. I'm uncomfortable with opting in based upon what we know right now. And the fact that we can continue to evaluate it and, we could change our recommendation or the Board of County Commissioners could go ahead and vote this in at any time, I think is the pathway that I would suggest in terms of a recommendation to the county commissioners. But I will open it up to folks, particularly, Kevin, sounds like you have some experience with this, so.
Well, I've seen a few presentations on it, but I think that the ROI and the payback is a longer runway than what the technology is lending to, and some of them are very elementary systems, and so I don't think people, if they're passionate about it, they're gonna figure out a way to do it themselves, and they're gonna have the knowledge because it's not a very commonplace item that people really look to offset their bill, perhaps, but I think it's more of a passion thing than anything. So, I'd be fine with the opt-out. And if we get inquiries, maybe we can revisit it.
Yeah. This has been on the agenda. It's been noticed. We have public comments, so maybe we have folks that want to talk about it, and that would influence we could revisit if folks do, and it would influence our decision. But I'm an opt-out and continue to monitor recommendation to the county commissioners. Any other comments on this before we move to public comment? Is there any public comment in the room on this? Is there anybody online that would like to comment?
No, Mr. President, no public comments.
Thank you. We don't need to do a formal, I mean, we're,
No, this is just.
yeah.
You may take action, you may take no action. Your options would be recommend opt out, recommend opt in, something in between those, or you could simply monitor, and take
guess-
no action and monitor.
I guess what I'm asking is, in order for our recommendation to be passed along to the county commissioners, do we need to adopt it formally?
I would say, if you want the recommendation to come from the Board of Health should vote on the
Okay.
recommendation.
So is there, I would accept a motion and a second to recommend to the Board of County Commissioners that they opt out of the grade water regulation, but continue to monitor in order to see if that decision should be amended.
So moved.
Second?
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Aye. Opposed? Excellent. Thank you. The next item on our agenda is the last, oh, no, wait a minute, not the last item on our agenda. This is the request to update environmental health fee schedule. This is an interesting one. Director Hill, why don't you either lead us through it or call somebody up here who can?
So again, Skylar's getting her, she's quick, she's got her presentation up, but
Oh.
basically there are a bunch of fees that are set by the state that we're just informing you of today. They're gonna change whatever we think. But also there are fees that are set by your board that we adopted in 2022 that, are falling behind on meeting the expected portion of the cost of the program. We can't charge enough to fully recover the cost of some of these programs, but we try to get close to it, so we're not using the taxpayers' general fund money to support things that fees should be covering. So this is our attempt to get closer to cost recovery, and we're suggesting a ramped increase, year by year, just like the state does a triennial review on the restaurant fees, and then they ratchet it up over a 3-year period. We're suggesting that we follow that model. And I keep stealing Skylar's thunder. She's been dying to present on this.
You're doing great. Thank you so much for the assist.
What's driving the need for the fee increase?
Yes, so that is a great question. We have, the state legislation has made their changes, but we also have identified that we would like to align our fee schedule with what happens during our triennial review at the state level, just to make sure that these things are keeping up with the Joneses, if you will. We've been a health department for 3 years now, so we can really see what expenditures we have had, and we can benchmark against those. And my predecessor did not include the fringe benefits aspect when she did the original calculations back in 2022, so we would like to make sure that we recapture those. Our methodology, we'd like to do a 10 to 15% annual increase for the next 3 years and then reevaluate at that period of time. We also know that the funding that is provided to us by the state is being clawed back, and without any of those adjustments, we will rely on those general funds to subsidize what we do.
Not including, so benefits weren't included in the original calculation for staffing for the program. Is that's got to be a big chunk of this. So really what you're doing, and I looked at this and I talked to Michael about it, really what you're doing is there was an underestimation of the cost of the program based upon not including the cost of benefits for staff. And you've been carrying that for 3 years, but that's becoming sort of unsustainable to continue to carry without actually dipping into the general fund, which, gets a little hairy because this is supposed to be a fee-based program. Is that fair?
Yes, sir.
When you say the funding for state is being clawed back, what does that mean?
Yeah, so we have a contract with the state to do the inspections and the services that we provide here at the county. As those funding dollars are going away, they're not being passed through to us as the locals.
Yeah, so if I can, the governor took back some general fund contributions to the state health department, which is reducing allocations from them to us by 14.5%. And that part of that is for environmental health fees. So they give us a small amount of money to go out and do all this permit stuff. It's a pittance, but it's still a part of the equation of the cost of the program.
So you're seeking to backfill what the state is taking
But
back.
again, that's a small portion. It's like, you know, the benefits weren't included. Every year, the commissioners very nicely grant the staff increases. So our costs have continued to escalate every year, and we've not asked for a fee increase in 3 years.
And clearly, if you want to continue to maintain the same excellent staff that you have, you can't just hold them flat. Okay. Other questions, comments? Concerns? Criticisms, critiques? Okay. Kevin, do you have a question? You were looking pensive.
Yeah, I just, you know, I reviewed the original tri-county budget, and the findings were that so many of the programs that were on their books, and the $7.10 at the time, I don't know if that's gone up, per resident is what was collected, which is essentially $7 million at the time. All the drivers and the funds that were getting pushed through the tri-county system were all external or add-on programs. And are you maximizing those programs similar to what Tri-County was doing? Because I know that was the majority of their spend through that. So I'm just curious if that's, and you're telling me that those programs have now falling off, like, you know, teaching, you know, lactating mothers was like the highest spend by the Tri-County Health Department for their additional spend outside of the core. So any comments to that? Is that kind of the same strategy, or is that falling off?
Well, I mean, the lactation education, we get funding for that through WIC and other maternal child health programs. That's not really connected to these environmental health fees.
Got it.
So we have things that are covered by state grants and allocations, and things that are covered assumedly by their fees, including vital records, environmental health. And then there's, you know, the gap, because if we tried to charge somebody what it actually costs us to provide them with a septic permit, you know, their heads would explode. So we don't want people's heads to explode. So we know that the taxpayers have to eat a chunk of this cost just to keep the program going. But a lot of what Tri-County was doing, you know, when you talk about extra services and outside, we cleaned that up when we started the health department, because we had workshops with the Board of Health and the commissioners where we sat in a room and looked at, here's what Tri-County did, this is what it costs, do you want us to do that, yes or no? And we went from like a big long spreadsheet to a very short spreadsheet of the services that we now provide. And every service we do has been approved by the Board of Health. We don't have a lot of ancillary things like they'd had clean indoor air people. Well, we don't have that because the use of it in Douglas County was extremely low. So there's no sense setting up a program for a couple of people. So there's not a lot of, you know, add-on stuff that there's not funding for.
I understand. And I apologize, I was taking that 10 to 15%, and you said it was in environmental health, so I was kind of lumping those percentages together, so I apologize for that.
Yeah, these are mostly like septic fees, pools, what else am I missing?
Yep, so that'll be all of the items on the right there. Body art, childcare, environmental record reviews.
And I know the big issue when you know, during the launch was the availability for the septic tanks to get assessed, whether, you know, approved and assessed, so that somebody didn't sit without facilities for, you know, months at a time.
Yeah.
Is that outsourced currently?
The inspections are not outsourced, but you explain it.
Yeah, so we have We have a number of companies that we work with in the county that provide inspection reports to us for review, but our inspectors are also out in the field verifying the results and issuing permits, approving systems and how they've been constructed.
Gotcha. Okay, I haven't heard any rumblings of it, but that was a major concern, so it's good you got that stood up.
Yeah, I mean, we had one brief period where we had someone who left and, you know, we've got a program that runs well on 3 people and it was down to 2 people for a short while, so a couple of people got delayed a little bit, but, you know, we can't staff for the high points. We've got to staff kind of a little bit above the average. So there's going to be, you know, rush hours when things might fall behind a little bit. But overall, I've not been screamed at. Well, I've been screamed at once. And that person went on and screamed at President Benevento. But that's the only, you know, septic tank related screaming I've received so far.
Constituents?
No, it's not as prevalent in town, but, you know, all those rural locations, it's real important, right? So, okay, I'm comfortable that.
Well, great. Are there any other comments or questions? Yeah, that's Senator.
A representative, but yeah,
Oh,
yeah,
sorry.
whatever. Patrick is good. I'm just a has-been. So I'm the newbie here, so I didn't plan to speak much, and I wanted to listen more. But it sounds like it's always tough to vote on fees because no one wants to increase fees. But it's also important that those aren't passed on to all the taxpayer that wouldn't utilize these actually licensing bodies. And so it's always difficult, but it seems to me like you guys have struck in a good balance. So thank you for that.
Thank you. Well, with that, if there are no other comments or questions, I would accept a motion to, oh, goodness, I apologize. Yes, public comment. Are there any comments in the room? Are there any comments online?
No online comments, Mr. President.
Great. Now I would accept a motion in a second to update the environmental health fee schedule.
Move to update the environmental fee schedule.
Do I have a second? And I have a second. All in favor, say aye.
Aye.
Aye. Opposed? Excellent. Great. The second to last item we have is a request to approve the Health Department's draft budget for fiscal year 2026.
Yes, sir. So state law requires that each year your board present a budget to the county commissioners. And we've prepared that budget. It's basically a flat budget. It includes all the funding that you've already accepted earlier in the agenda. If you hadn't accepted that, we would have been back to the drawing board on the budget. The only thing that I'm really adding in here is, it's a small number, but I want to put some paid internships for students next summer. We've had some free student interns, and they've done a lot of work for us, but I think we would draw more interest from students and be serving them better if people could make a few dollars over the course of the summer and help us and learn something. So I haven't really sold the HR department yet on creating these positions, but I'm including the money in the budget, assuming that I'll convince them to let this happen. Otherwise, and Rich is in the back, he can shake his head if I've done anything. There's nothing else really changing in the budget. It's just status quo based on the funding we've received, and a few little brief, you know, a couple of these have gone down a couple of dollars over the year, but nothing significant.
Okay.
And we are holding at this point $1 million cash position, and I think that'll come in handy in the next year or two as the federal and state funding systems are going to go bonkers, and we'll be able to use that as a cushion to ride through, and was my strategy in amassing that money over the almost 4 years.
Okay. Well, reserve's always a good idea. Are there any questions on the budget? I kind of feel like I had the budget discussion when we went over the updates to the funding. I looked at it. There's really nothing new. There's nothing we haven't discussed previously, and it's a status quo budget. So, for the most part, so I don't have any questions either.
Mike, I was really impressed with the budget, seeing it from kind of the retrospective position and kind of look at those numbers. So very, very well done on on running a very lean organization and as compared to where things came from. So, good job.
Thanks.
As opposed to where things came from, yes. That's true. Okay, I have nothing, I have no questions on this, so I would ask if there is any public comment in the room. Is there any public comment online?
No online comments, Mr. President.
Okay. With that, I would invite a motion and a second to approve the Douglas County Health Department's draft budget for fiscal year 2026. And we have a motion.
I'd like to move to approve Douglas County Health Department's draft budget for fiscal year 2026.
So do we have a second?
Second.
And we have a second. All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Finally, we have Director Hill. You would like to change our meeting date in December.
Yes, sir. So the county is having an event on December 11th that the commissioners want to attend. So they've requested that we consider moving our meeting for December. And my suggestion is that we move it to the previous day, to Wednesday, December 10th.
You didn't want to do Friday?
Well, I'll do Friday. That doesn't bother me. Yeah. If we can get a quorum, I'll come on Saturday.
I think Wednesday is a shrewd option. Well, yes, I think that's a great, particularly if the commissioners can't accommodate that day. I think it's compulsory that we move it. So I would accept a motion to change the date of the December meeting to Wednesday, December 10th at 5 p.m. If there is a motion and a second, we will vote.
So moved.
Second? We have a second. All in favor, say aye.
Aye.
Opposed? Okay. In which case, we are now at the end of our meeting, and we are at citizen comments. Are there any citizen comments? General comments and anything on your mind? Is there anything online?
No online comments, Mr. President.
Okay, and finally, before we leave, I want to correct a couple errors I made. First, we have Councilman Brocken here from Castle Rock. I should have welcomed him, and also Representative. Former.
Has been.
Yeah. Here, and I should have recognized them. They're excellent stand-ins for the county commissioners, and we appreciate the time you took to be here. It does take time to do that. Second, and I should have acknowledged this up front, probably before or after the pledge, this is September 11th. I mean, 24 years ago, we were all wondering what was going on and sitting in front of our televisions while we were doing it. And I just happened to notice that there was not as much discussion of it this year. And September 11th kicked off a lot of events that had people uprooting their lives to go off to a foreign country to defend our nation. And I just think we should take the time to recognize it. So I did. So with that, I would accept a motion and a second to adjourn.
Motion to adjourn.
Second.
All in favor, say aye.
Aye.
Opposed? Thank you. Thank you all.
You know you got